1.
Okay, so I'm in the med room. I'm going to wash my hands. I see we have an order for the sterile line, or the central line dressing change for Cee O Peedy. And we also have some flushes to give her as the saline and the heparin. I'm doing my first check right here, seeing that it's appropriate. I also noticed the length of the central line is noted as 12 centimeters, so I'll be sure to measure it while I'm in there. And I have all my supplies here, so without further ado, let's walk in.
Come in.
Hi there, my name's Andrew. I'll be your nurse. What's your name and date of birth?
Cee O Peedy, 12/3/2001.
Okay. All right. Well, Mrs. Peedy, let me scan you right in. Do you have any allergies to latex, adhesives, or antiseptics?
Nope, none of the above.
Okay, so while I'm here, I'm going to do my second and third med checks for the heparin and the saline. So they're ready to go. Mrs. Peedy, have you had your central line changed before?
I have not.
Okay, so what it basically is, it's a sterile procedure where we like to change it every 5 to 7 days to make sure we prevent an infection, as well as making sure that it's the right length and that everything is looking good and not infected. Does that make sense?
Yeah, but what are those thingies you were holding?
Those thingies? Those are just the flushes. So while I'm here, I'm also going to flush your central line to make it open, and so it's not no clots are building up, and so that there is so that your central line is clean, and so that it doesn't have any clots or any backfill.
Okay, makes sense.
Yeah, good.
Sorry, I was just curious.
No, good question. I'm going to set up. Before I do that, how would you like a mask?
I will take one if I have to.
I think you're gonna have to for this procedure.
All right.
Because we want you to face away and make sure that it's all sterile, and we avoid talking or breathing heavily so that we can make sure that it's turned away. Wonderful. I'm gonna take out my making sure there's at least 1 inch of wiggle room around. I'm now gonna dump some of the sterile stuff that I'm using onto the sterile field. Sweet. And I got my triangle set up, so we are looking great. Okay. I'm now going to look and see what your central line looks like. So while I'm looking at this, I'm observing that these are all clamped, as well as feeling around to feel any warmth or notice any redness. Do you have any pain while I press around here, Mrs. Peedy?
Nope.
Okay, so there's no sign of infection as I can notice, so it looks that it's ready to go. So I'm going to remove the stuff here. I also note if there's any sutures present, but there aren't. While holding here, we're gonna do it distally to proximally, just kind of rolling this up. I'm also going to remove the patch right here. Throwing that away. Now I'm going to remove the gloves, wash my hands. And I'm going to put some sterile gloves on. Alright, now that I'm here, I'm going to use this, click these two together to apply the applicator, as well as I'm going to hold this right here, just to make sure my gloves stay. And for 30 seconds, I'm going to scrub around the area, underneath, and I'm going to go with this. I'm going to just hold on to this like that. I'm going to apply the patch here. So that's all good and dandy. Making sure the blue is facing up. Now I'm going to drop this, and with my left hand, I'm going to slowly unpeel this part, and then grab this like that. And put this with my left hand. And then with my right hand, I can kind of push it down. Okay, I'm gonna take this piece of tape right here. Put this, I no longer need to be so sterile. Now I'm going to measure the length of the central line. So I see here that it's about 13 and a half. So I'd note that in the chart. Making sure that that's noted. I'm going to sit right there. I'm going to put down the time, which is 1700. /30, and then my initials, daytime initial. Setting this right here, as well as securing the dressing right here. Okay. Now I'm going to push the medication that I have, which is the saline and the heparin, to make sure it's just open, staying potent. I'm gonna make sure that I have everything ready here. Just making sure that I do this asterally. Okay. Just making sure that there's a little bit there. I'm gonna remove this. I'm now going to unclamp it. I'm going to aspirate it, and if there wasn't any blood return into the syringe, I would have the patient reposition, raise and lower their arm to make sure that there is blood flow back into the syringe. Okay, so now over a minute, I would give the saline, but I'm not going to do that over a minute. I'm just telling you that. So that goes through. Okay. Now I'm going to taking this off. This. Okay, about that. I would give this just slowly over. So not as long as the saline, but just administering it slowly. And then we got our green cap here. Okay, and then I clamp it. And then I would cover it back up. I would get rid of all my supplies here.
Yay, we're all done?
Yes, we're all done. We made it. Here is your call light. Put you right there. I would document that I administered the medication, as well as did the dressing change, as well as note the length of the central line. Is there anything else you need from me, Mrs. Peedy, before I go?
Besides my mask. I don't like wearing the mask.
Oh, yeah.
But no, I should be good.
Yeah, I'll be sure to take that off from you. There you go. Well, if there is, you can let me know.
Okay.
I'm gonna go to privacy. Let me know if there's anything else you need.
Okay, thank you.